We as a nation are inching actually closer to the 53 crore mark, as over 57 lakh people have been vaccinated within a single day, of which 45 lakh beneficiaries received the first dose of COVID-19 jab, while 12.2 lakh people received their second dose. So the number of people receiving their second dose is also slowly going up, and this will only increase in the days to come as that 84-day period comes to fruition in terms of the gap between Covishield dose 1 and dose 2. There are many who are also opting for Covaxin. Slowly, Sputnik V and other vaccines will also be available come September. Pushing the vaccine drive forward, the centre has so far released 55.01 crore jabs to states and union territories. So over 2.8 crore jabs are still available with states and union territories and private hospitals, which are yet to be administered. So we can continue to pick up the pace. Dr. M.S. Kanwar, Senior Consultant, Department of Pulmonary, Indraprastha Apollo Hospitals, is with us. Dr. Kanwar, good to connect with you again. Always a pleasure to speak to you. And we are looking at close to 53 crore jabs just around the time there are indications that there is a surge in positivity rates even among children and perhaps the onset of a third wave.
Yeah, that is something which was partly expected. The only thing to ponder over was how bad, how big, and how prolonged will the third wave. The most experts would probably consider at this point in India that the third wave would be relatively muted. And it may be a little prolonged, but it would be muted, not like the second terrible wave that we have had. I don't think we'll be going anywhere close to that. Coming to the children, probably that is one group which has not been vaccinated and is not close to vaccination for the next several months. So, but it's not that it is this virus in its new form, the Delta or the newer variants that might still be coming up, is selectively picking up the children. It's not like that. And it's also not the case that the children are getting more affected or are worse off as far as disease severity is concerned. So I think, keep our fingers crossed and keep taking the precautions as best as you can. And in those areas, those states where the disease tends to show up its ugly head again, the states will have to take a countermeasure immediately, and very strict lockdowns might be required in those states.
True, but like you said, the third wave, we may see a surge in the total number of cases, but the severity may not be as much. Do you also feel that because of what happened in the second wave, Sero survey is also saying that a lot of people are also asymptomatic, plus we getting close to at least 53 crore people in our country, that's a huge number, who have actually taken at least one jab. You think all of these aspects will also come into play to ensure that even though there is, like you said, a prolonged third wave, the severity of the cases is not as acute as it was in the second wave?
Absolutely. You picked it absolutely right. That we've had a surge, a large number of cases of the population was affected. Even if we count the first wave patients and those patients, the first wave, who were asymptomatic, and particularly in the second wave, where the numbers were several times more, and there would be probably equally large number of asymptomatic patients, all put together, plus 53 crore jabs. Yeah, they all have increased the zero positivity rate to such an extent that the disease would be muted. That's why we feel that the disease would be muted. Even if it's a bad variant like a Delta, which is affecting the Indonesia, Malaysia, and other places, and USA also. But India has already had its fair share, and so probably we're better off than other countries.
True. Final question, and quickly, do you think many people who are coming, who are due for their second vaccine, second dose, is just around the time we could be on the cusp of the third wave? So getting that vaccine in time could also perhaps help mitigate a surge in cases or surge of COVID-19.
Yeah, I agree with you totally. Yeah, one should not miss the second dose. And in fact, I've been advocating that in case the third wave is right around the corner, then even if you have not spent 3 months after the first jab or after the after becoming negative after COVID disease, even if it is not 3 months, if the disease is around the corner again, you should have the second jab earlier.
True. Dr. Kanwar, thank you very much for speaking to us here at CNN News 18. Always a pleasure to connect with you. The other aspect, ladies and gentlemen, are sanitizers harmful? Do vaccines modify your DNA? Do they infect you with COVID-19? Are there questions like these in your mind? There is a space where all your queries can now be answered. As part of Network 18 and Federal Bank's campaign, a WhatsApp helpline has been launched. All you have to do is WhatsApp on the number 7977773753 and you'll promptly receive your answers, information which has been verified and cross-checked. So go ahead, WhatsApp your questions on COVID-19 and get all the information you need. The number is 7977773753.